tight, I gave the pillow dirty looks. Then I did it again. And the next day, it was in the neck and down in the shoulders, and now the whole world was wobbling. I moved my head, just rotated a little bit, and it took a second for the world to catch up. Right? It was like the whole world was made of jello, or everything's underwater. It's like a video camera with poor image stabilization, like there's delay. And so I stopped at that point because I said, oh my goodness, right? I've gone past this 3-day definition of a migraine. Right? I created this transformed migraine. I knew I had done that. So I said, okay. I don't want to have to deal with this after the vacation's over. Let's stop. I did everything right, and it still took me 2 weeks to get rid of it. And I knew what I was doing. Okay, so this takes a while. This could take weeks to months. But if we get all these pieces right, 0 caffeine, 2 out of 7 rule, prevent it. You have them all true all at the same time. It's combination law. You need all 3 numbers. Get them all true at the same time, the ocean starts to drain. And when it does, then you get to the first hike. Then the headache comes back, but then you get to the second hike. Eventually you get to 30 days headache-free. That's when you add back your favorite cheese or your favorite chocolate. Yeah? Okay, Dora has a question.
Hello?
Yeah.
Yes, go ahead. I'm not hearing you.
Did you say Kara has a question?
Dora.
Okay, I'm not Dora.
Oh, okay, well, Kara, ask away.
My question is that with migraines, is it typical to get sharp shooting pains in different parts of your head and then it goes away really quick?
That is less typical, right. People can get ice pick headaches, and those have a slightly different character and a different treatment plan. Yeah.
Okay, I have a question.
Yes, there we go.
Yeah, so I heard about red infrared light therapy that
Yes.
might help.
Save your money. Save your money. Don't buy any
Really?
equipment that didn't exist 5,000 years ago.
Okay.
Except for sunglasses. Right. So, yeah, I would avoid all of the machines and all the gadgetry. Yeah.
Okay.
Yeah.
Thank you.
Yes. Okay.
Can you touch on the ice pick headaches?
Oh, yes, sure can. Yes. So, ice pick headaches are very brief. It feels like somebody just hit you with an ice pick and it went in and it stays in. And it's somewhat related treatment-wise to what we do for exercise-induced headaches and for orgasmic headaches. These types of headaches respond to a medicine called Indocin. Okay, and so they're classified as Indocin-responsive headaches. Right? So if you have ice pick headaches, ask your primary doctor about this. And it's it's something like before exercise you take this. Right? It's something that works like magic when it works. If you have that particular type of headache.
Do you guys know what like how migraines have like oncoming symptoms? Do ice pick headaches have like similar things?
Not so much. They just happen. They just strike. There's no predicting that.
Okay.
And even migraines, only 20% of us get aura. The other, 80% of us don't. Right. This is common migraine. This is classic migraine with aura. Right. So it's yeah. Yeah, and these are different. They're also complex migraines. So there are people who have, half their body, it feels like there's water dribbling down slowly, and that's a sensory aura. Other people, half their body doesn't work, and they fall down in the middle of the supermarket aisle. And everybody thinks they've had a stroke except they're 20 years old.
Right.
And that's a hemiplegic migraine. So there's a big range. Yeah.
Okay. Interesting.
Yeah.
Oh,
questions?
Do scents have anything to do with migraines or ice?
Oh, yes. Thank you. Yes. So, you could set it off with, a certain smell. Yeah, it's curious, and particularly artificial ones. right? So a lot of the things that we associate with smell are actually artificial, or highly concentrated, right? And so you can get a very pure essence of something or other, and it can be just terrible for you, right? But even things that that are perfumed, that are artificial, that are made, um, can set things off. So yes, thank you for that. Yeah, absolutely.
Because I work around a lot of wood, like at Home Depot, and I feel like it's only at one location where like the headaches are extremely overpowering. But I didn't know if
Yeah.
you deal with it.
Yes. Yes. See, it wouldn't happen in nature, right? It's wood, but there's treatment involved.
Right.
Right. There's some other, powder in the air from just drilling and, whatever, sanding and things. It's something about the processing is different. Yeah.
Okay. Thank you.
Sure thing. Yeah, sure thing. Okay. More questions?
This is Kara again, and
Yes.
I was the one who asked about the sharp shooting pains.
Right.
But I've had this headache for almost 4 months now.
Right. So it's changed. It's transformed, right? And so something has happened along the way. And so, if you want to connect with your primary doctor and see about seeing a neurologist, that would be perfectly reasonable.
Okay. Thank you very much.
Sure thing. Yes. Okay. More questions? Please.
Dr. Lee, I have a couple questions.
Yeah, sure.
First is, are we to see our primary care to get these preventative medicines in the treatment medicines?
Sure
And
can.
then along with the treatment medicine, if I've been taking a treatment medicine for a long period of time and the dosage I'm using doesn't impact the migraine any longer,
Right.
can they up that? Should we change that?
Yes and yes. Right.
Okay.
So you try something for a few months, right? Because it takes a little while to work. But once you know it's not working, you have to change the dose or you have to change the medicine, right?
Okay.
And so I do like the tricyclics for phase A. Okay. So these are tricyclic antidepressants. Oops, there's the camera. Yeah. Okay. So these are things like Amy, right? We talked about Amy, Nora, Desi, right?
Right.
Okay. But then there are also medicines like propranolol, which is a beta blocker. Okay. And this is great if you get nervous or you have a tremor. It helps with those too, but it's terrible if you have asthma because it makes asthma worse, right? And then there are things like calcium channel blockers like verapamil. Okay. And then there are things that are more complicated, like Depakote, medicine we never give to women of childbearing age because it can cause birth defects. There are all sorts, and there's Topamax. Okay,
most of those I've tried
yes,
with no success.
Yes, and so you have to wonder, well, were you in phase A or were you in phase B? Why did they fail? Did you have all three pieces, right? And so that's the sort of analysis that I would recommend, is saying, okay, well, the time that it failed, what was going on, right? Was I at zero caffeine? Was I under the 2 out of 7, while I was taking that preventative? Or did the preventative truly fail? And did it fail because of side effects, or did it fail because of inefficacy, right?
Right. And then my last question is, are other dairy products to be avoided as well?
I don't put them on the list. Excuse me. I don't put them on the list. I'd say cheese only.
Okay.
Because there's something about the process of making cheese that concentrates the tyramine.
Okay, thank you.
Sure thing. More questions? Please. Yes, Olga.
Yeah, a couple of things. But the main one would be I'm on an elimination diet now for about 30 days. So just like meat, water, salt, right? To just try to figure it out because it's been so severe. But I wondered if because it seems cyclical, hormones, menstrual cycle.
Oh, absolutely. Yes, exactly. So, right. So if you imagine day 0 of your period, plus minus 3 days. That's the usual window. Somewhere in this window, you're more likely to get a migraine. Some people only treat with a preventative during the week before day 0, all the way through the week after day 0. Right? Absolutely. So I would say if you're on any birth control, low or no. Okay, low or no estrogen. Okay, it's low or no E. Okay, there are birth controls that are progesterone, right? P, but you want low or no E.
Okay. And so I'm only, well, right now I'm doing Imitrex. I've been doing that 100
Yeah.
milligram doses a month, but we haven't gone that far because I've only done the elimination diet now for almost 30 days, which has been very hard, but I've learned a lot. So
Yeah.
that was, I've only been able to go through one cycle where I thought maybe that does have something to do with it. And then my last question was specific to facial pain. I'm noticing now I
Yes.
have pain on one side of my face, and if I put pressure or touch my face on that side, it hurts my head. So, I can touch my eyebrow and it makes my head hurt. Is that normal, or is that not migraine related?
Well, it's not uncommon to have sensitivity, but I would definitely check it out. So if your primary doctor hasn't heard about it, I would go through a neurologic exam in the office just to make sure. Yeah, nothing scary, but just I would do it.
Thank you.
Yeah. Okay. Kara.
Yes.
Yeah, you raised your hand. Sorry.
No, I don't know how to undo that.
Okay. All right. Anybody with a question? All right. Well, we're getting on to 4 o'clock, so yes, I think we'll